The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanik, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, everyone. Welcome. We are here gathered for the next episode of TMD Demystified. I am Tony Urbanik. Today, we have a rather profound topic to discuss and enlighten you on, which is entitled Educating Patients and Providers is Critical in Treating TMD. Now, if those of you who follow me, and for the few newcomers, let me digress a moment. Many of you have heard me talk about why it is important to educate patients, but today we're going to take a little different tact on it from the viewpoint that the Urbanic Device and Tool, the Urbanic Device and Protocol, the Urbanic Device and Protocol are actually tools to use. And if you learn how to use the tools correctly, you will get spectacular results. I've talked so many times about how it works, how chronic inflammation, singular chronic inflammation, drives all of the symptoms of TMD. We won't go into that again, but you can look on prior episodes and find it for yourself. I know after 50 years experience, 36 of those doing oral and maxillofacial surgery procedures on the temporomandibular joint, and the last 15 years doing non-surgical treatment of the temporomandibular joint using a very simple device and protocol that we had to call the Urbanic Device, because the patients wanted to call it Miracle Device or Save My Life Device, and I couldn't deal with that. So we just branded it as the Urbanic Device and Protocol because the treatment comes in with two features. It is the device itself, and there's tremendous misunderstanding from patients and doctors, even doctors who are currently network providers, that they are getting a piece of resin, a piece of plastic, a widget that you just use any old way you want to use. Well, that is farthest from the truth, because when you understand what causes, which was my discovery, what causes TMD is chronic inflammation in the joint, directly causes each and every one of those disparate symptoms. Getting back to the point, this is a tool. Now, you can call it a widget. Most patients wanted to call it a retainer or a night guard, and this is anything but a night guard. We'll discuss night guards in a moment. Again, it's a tool that fits in the roof of the mouth, and whether you are a current network provider in now 18 states and growing who are licensed to use this, along with our doctors here in this practice in Middle Tennessee, or you are a patient who wants to alleviate themselves of the terrible disparate symptoms of TMD problems, headache, earache, jaw pain, neck pain, ringing, fullness in the ears, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the primary symptoms. There are also some secondary symptoms. If you're either a doctor or a patient, you must understand that this is a tool. But if you are a professional and want to do the best job you can, you have to know how to learn how to use your tools. And you can't just use it any way you want. If you have an automobile, that is a tool for transportation. And transportation is very important, but you cannot use that tool, automobile, unless you are trained to use it. Now, some people are poorly trained, admittedly, and some people are highly trained, admittedly. But the people who are expert, who are professionals, they learn to use that tool, whether you're driving a car, a bus, or a truck, as an expert. And the more you know about that tool, again, like an automobile, the more not just how to drive it and the mechanics of driving, but the more you know how that tool works, the mechanics of an engine, the mechanics of brakes, how brakes work, how transmission works. Same thing applies to airplanes. I've been a pilot for 55 years, and I can attest that pilots who understand their airplane extremely well, not just how to manipulate the controls, that's the easiest thing about flying, but how to use that tool effectively, how the engine runs, how the different systems work within the airplane makes you an expert, makes you a professional. The more you know about your tool, the more professional you are. Now, this applies not only to the providers, it also applies to patients. And in our practice and what we teach to our network providers, it is critical, it is important that we teach the patients exactly how this tool works, because they have to take the responsibility of using it correctly. But honestly, none of this is rocket science. So don't be afraid that this is information that is so complicated you're not going to understand it, because no, it's not complicated at all. It is very simple how this tool works. But the point of this, and I'll go over how it works in a moment again, but the point is it is critical. It is very critical that the network providers who provide the service, including the doctors in our practice here in Middle Tennessee, and the patients themselves understand how the tool works. You can't just give it to somebody, pat them on the head, and say, good luck. So the tool itself works very simply, just like a set of crutches works on a bad knee. If you had a bad knee and it was painful, and I can promise you, if you had a bad, painful knee, there is chronic inflammation within the knee. And if you didn't want surgery, and you didn't want injections followed by surgery, then the orthopedic surgeon would give you a set of crutches and say, here's a set of crutches, get off of the knee, and sooner or later, all your knee pain is going to go away. You just got to stay on crutches. Well, this tool is basically a set of crutches for the temporomandibular joint, but you don't have to wear it 24/7 forever, but the protocol is very simple. We have found that the protocol of using this tool, which you can speak with nicely, easily, you can drink with it easily, both hot and cold foods, liquids. You can certainly breathe with it without any problem. You just can't chew with it in your mouth. So the protocol is 24/7, except when you eat for the first 2 months, then nighttime only, indefinitely the rest of your life. And using that protocol and a tool that does nothing more, nothing less than unload the temporomandibular joint, like a set of crutches unloads a damaged knee, you will get the result. And the symptoms, the very well-known disparate symptoms of temporomandibular joint disorder, again, singular disorder, it is not multiple disorders, go away. And that's the crux of the whole thing. But getting back to the topic that I want to speak on today, how important it is to educate the how and why of this device. And again, not complicated, not a series of things that you have to know technically too far. The patients need to know about chronic inflammation. And again, all of this can be fact-checked easily, how chronic inflammation through the autonomic nervous system directs the muscles that move a particular joint, in this case, move the TMJ. to tighten up. And when those muscles get the direction to tighten up, don't move the joint itself in order to allow the joint a better chance of healing. That's why it does it. The autonomic nervous system tries to help the joint and help it to heal. But when that does, it tightens up the muscles, and wherever the muscles of mastication are attached to the jaw and face in all these areas, which move around from time to time, the patient will experience head pain. And then when this continue the signals, I'm inflamed, the joint's inflamed, the signals come back down. I told you don't move the jaw. Now tighten the whole head, tighten the neck. And the second most common symptom is neck pain. And when it goes on beyond that, then the upper shoulder girdle gets tight, and patients can complain of upper back and shoulder pain and tightness, and arm, hand, finger tingling and numbness. I've actually had documented 3 separate patients who had chest pain from the muscles of the upper chest tighten up to the point they thought they were having a heart attack. Of course, when they went to the emergency department and went through the usual workup for myocardial infarction or heart attack, it was negative. Nobody could figure out why it felt like a heart attack, except it was amazingly so, generated by inflammation within the temporomandibular joint. It's amazing, but you got to know a little bit of anatomy and a little bit about the autonomic nervous system and a little bit about how the muscles are attached to the bone and a little bit about histology, where the nociceptors are the receptors that create pain when they pull on the bone. That's a histology question. But none of it is complicated. And you don't have to know the big words. Doctors feel they're important by using Latin, but you can just use regular old English words to get the point across to a patient. And the doctors themselves should understand this, because they all, in dental school, if you are a dental doctor, and even if you are a medical doctor also, you took a course in gross anatomy, histology, neuroanatomy, and you should know this stuff. And it's easy to explain it to a patient. The real point is, you have to take the time to explain this to a patient. That is why half of our job, my job as an individual doctor, I happen to be both a medical doctor and a dental doctor with both medical and dental degrees and a degree in anatomy and cell biology with special training in facial growth and development and fellowship with the NIH for 2 years on facial growth and development. So I have a little broader background in understanding anatomy, medicine, dentistry, neuroanatomy, histology, and importantly, cell biology, chronic inflammation. And that is how and why this device came to be, because I took a very independent study of how in the heck can you get so many disparate symptoms, and how in the heck it's been 50, 60 years, nobody figured it out. And to this very day, 98% of doctors, either 50% don't want anything to do with TMJ because they think the joint is complicated. That's what they were taught in dental school. It's a complicated joint. It's unlike any other joint in the body, which is not true. It's a big lie. It is not a different joint. This joint operates like any other joint in the body. And that's why the dentist could never figure it out. And the physicians don't want anything to do with TMD coming from the TMJ, because the TMJ is attached to the jaw, mandible, which is attached to teeth. And that is the humorous reason why the orthopedic surgeons don't want anything to do with the temporomandibular joint. But I maintain that if the orthopedic surgeons had maintained control and did their research on how you can get such disparate symptoms from the temporomandibular joint, they would have had this problem solved a long time ago. But the fact that it had to do and connected to teeth somehow scared them off, and they gave it to the dentist to figure out. And the best that the dentist and the dental schools could say is, this is a complicated joint, it's different, it's unlike any other joint in the body, and we don't know what to do about it. And so you have TMJ, the small percentage, 1/10 0.1% of dentists I call TMD gurus, who do smoke and mirror things, smoke and mirrors and nonsense and voodoo to try to treat the problem rather than actually attack the cause, which is temporomandibular joint chronic inflammation. They use all kind of machines and Botox and dry needling and certainly a whole bunch of medications that at very best will treat a symptom very temporarily. And the patients go from doctor, doctor, doctor. And then the most egregious, very egregious, the most egregious attempt to treat this problem has been through using what the dentists call night guards. And night guard is nothing more than a device that covers the surfaces of the teeth and keep the teeth from cracking or breaking when patients clench or grind. That is called a night guard, which has no effect on the treatment of temporomandibular joint disorder, but is used by 50% of the dentists, 50% of the dentists in the United States of America. If they are confronted by a patient who someone, whether it be the patient or the doctor, or referred in by another doctor, says this patient has TMD, the dentist will prescribe and offer a night guard and has no idea what they're doing, how to use it, and cannot explain in any way, shape, or form how a night guard could possibly treat TMD, because it certainly doesn't stop bruxism, clenching and grinding. It just gives the patient something else to clench and grind upon. It has value for protecting the teeth. If you have a night guard in your mouth, and if you clench or grind severely, you cannot break your teeth with a night guard in place, but it has nothing to do with correcting temporomandibular joint disorder. So, again, educating the patient is the most important thing that needs to be done by a provider who uses this device. And the provider himself needs to be educated as to exactly how it works and needs to be experienced enough and facile enough to get that information over to the patient, because actually then it is the patient's responsibility to use this tool correctly, and they have to know how and why it works. And what I have found is that the better the patient is informed and that they actually know what they're doing, the how and why of how this tool is effective, the more likely they are to follow the protocol. And that protocol has been worked out very carefully over now well over 5,000 patients. So that's how we know it works well. We've tested it on well over 5,000 patients successfully. So it's a very simple thing to understand. When I personally do a consultation, I take half of the time of the consultation to explain to the patient how and why it works. And when I'm finished doing that, I will always say, does that make sense to you? And with enough training, experience, and drilling on this, it comes easily. And 99% of the time when I ask that question, the patient says, yes, that makes sense. You are the first doctor who ever made sense in explaining this problem to me, or something thereabout. They all don't say exactly that, but they all say, if I ask that question, does that make sense to you? 99% of the patients say, yes, that makes sense. And the 1% that doesn't, then we go back and find out what doesn't make sense about it, and we correct that. We cover that doesn't make sense. Because the whole problem does make sense when you understand all of the symptoms are driven by chronic inflammation. Unloading a joint, whether it be hip, knee, elbow, or temporomandibular joint, allows the joint chronic inflammation to decrease. When the chronic inflammation decreases, the inflammation goes away. It's that simple, but it does take time to educate, admittedly. Ask any grade school or high school teacher whether they're having how easy it is and whether they're having a good time and how easy it is to educate young minds. Well, it's the same thing in medicine and dentistry. I think that way too little time and effort has been done to educate patients um, as to why things are being done in the healing sciences. And I think I have a feeling that's getting more prevalent now. I'm hoping that it's getting more prevalent, although the time that is spent by our healthcare providers seems to be getting less and less, which doesn't allow them to educate patients enough properly about the how and why their treatments are applied. I think that is seen across the board by healthcare providers, but in this particular case, I have taken the responsibility of educating our network providers or any other dentist who wants to use the proper tool in the proper way to be educated, to become educated, and to be educated so that they can pass on that education to their patients. So, educating patients and providers is critical in treating TMD. If you have an educated provider who takes the time to educate the patient, and the patient takes responsibility to use the device and protocol, there are two parts. They are separate, the device itself and the protocol, how to use it. If the patient takes the responsibility to use it correctly, they will get spectacular results. With that said, I invite anyone to contact me if you have any questions or criticisms. Happy for criticisms. Make sure you bring your science with you. Make sure you bring your science with you if you'd like to discuss this and certainly criticize what I have to say. I am available at tmjservicesofbrentwood.net. Network providers or dentists who would like to use this device and protocol for their patients and become a licensed network provider, because this little tool, gadget, people like to call it a retainer. It's not a retainer. It's patented, has a license on it, so you have to be licensed. And if you'd like to be licensed and educated on how to use this, it's not complicated. You can go to our website at www.urbanektmj.com or contact me. I can get you to the people in the organization who can get you into the system, get you through the educational process, which is simple, and get you treating patients and helping the millions of patients, primarily women in the United States, who wake up every morning with these symptoms and misdiagnosed, by the way, as migraine, headaches, Meniere's disease, and ear infections all the time by my medical colleagues. I look forward to the next episode. I hope you all stay warm. We're here in Nashville. The date today is January 27th, 2026, and we currently have 130,000 electric homes that are out of service because of the ice storm. But I did not give up on doing my weekly episode. So I'm here again. I look forward to our next episode next Tuesday. I am Tony Urbanik, and this is TMD Demystified.